This is Bay Radio.
Hello. Without any concrete science behind it, regional governments in Galicia and the Canary Islands have today implemented a smoking ban for all public places. In today's daily update, we're going to investigate some of the reasons behind this ban, especially as other regional governments are currently looking at implementing the same protocols, including the Valencian Community, where we are in Javier, as well as Castilla-La Mancha and Asturias and Cantabria in the north, as well as the regional capital of Madrid. But first, today's statistics that have just come out. Let's go. Today's statistics show a sharp increase, breaking the 2,000 mark for the first time since the end of lockdown to record 2,935 infections yesterday. During today's press briefing, Spain's Director for Health Emergencies, Fernando Simón, said that September will be a risk month, but Spain is nowhere near a systemic collapse. He said the large numbers of new infections were due to efficiency and expansion in PCR testing, something that can be noted by the large number of asymptomatic patients as seen in this graph lower down. These patients are much harder to track as they do not present symptoms and are not likely to go into a hospital, and so in Fernando Simón's eyes, this could be seen as a positive. But now for some analysis. The Covid-19 spotlight is back on smokers in Spain, as the government of Galicia and the Canary Islands ban smoking on streets, on bar and restaurant terraces, and in any otherwise enclosed public space. But the question we are asking today is, why? If we go to the Galician State Bulletin, a document published yesterday says the World Health Organization has already expressed concern about smoking, particularly in the expulsion of respiratory droplets that could contain a viral load and be highly contagious. If we actually look at the WHO's website, however, we can clearly see there are no peer-reviewed studies that have evaluated the risk of Covid-19 infection associated with smoking. The closest study that is cited by the WHO did find that Covid-19 can survive in aerosols or aerial solutions, droplets in the air such as those that can cause mist, for up to 16 hours. However, for the study, Covid-19 droplets were blasted through a nebulizer into a rotating drum, which sounds a far cry away from a ciggy and a pint with a touch of sea breeze at your Spanish local, though some neighbours of discotecas might disagree. Smoking, despite the name, isn't all about the smoke, however. Another document referenced by the Galician Bulletin that we've just looked at dates back to July the 2nd, when Spain's Public Health Commission urged the government to take a stance on smoking and coronavirus. In that document, government experts determined that it was the act of taking off one's mask and touching one's lips that creates a greater risk of infection. The research suggested that a pack-a-day smoker touches his or her face 300 times more than a non-smoker. Again, however, there is no scientific research to back up with hard evidence that a smoker will be more likely to either transmit or catch COVID-19 than a non-smoker. But what's interesting about this ban is the first region to implement it, Galicia, is far from the worst hit region in Spain. If we go back to today's statistics, we can see the region showed 107 positives yesterday, which is very high but still below 5 other regions in Spain. The government there, however, have taken many steps far beyond these other regions, and they've shut down nightclubs in the entire autonomous community, as well as they will implement this blanket ban on smoking even in areas where there are no infections. The president of the Canary Islands, Ángel Víctor Torres, also implemented Galicia's ban on nightclubs today, along with obligatory mask use and the smoking ban, which suggests that this ban is one of many options regional governments could adopt if they wish to implement severe restrictions to contain a sudden spike as happened in both these regions, despite these prohibitions not being the most effective. Spanish online newspaper eldiario.es put forward an interesting proposition yesterday on this matter to suggest what is happening here is a conflict between general public health and pandemic control. This is because Spain's public health research bodies, as well as the World Health Organizations and indeed health-related institutes across the world, will always say the same thing: reducing smoking is a win, regardless of there being a pandemic. Galician President Alberto Núñez Feijóo still believes that the ban will work, and he lashed out at his opponents and especially young people in his region yesterday to say, "I hope we don't have to see more wooden caskets to realise the virus is still out there. The virus is still out there." Whether the smoking ban will have any effect, we shall have to see in further analysis in weeks to come. And there was a look into the smoking bans that have been implemented in Galicia and the Canary Islands, and they're also being studied in other regions, including nationally. I am Joshua Parfit, the digital editor for Bay Radio, and as ever, please subscribe to this YouTube channel through the link on the bottom right of your screens. It should pop up now, as we'll be doing daily updates with the coronavirus statistics, as well as a bit of analysis to help you get to know what's going on with the situation in Spain. Please like our Facebook pages, download the Bay Radio app, and write in, comment wherever you can with any of your coronavirus questions and queries. Thank you.
This is Bay Radio.